Hello, everyone. Welcome back to my Dentistry Tuesdays, and today's topic is X-rays or radiographs. My name is Greg Chong. I've been practicing general dentistry for the last 25 years. I really love dentistry, and I'm happy to share. Now let's get into it. Radiographs or dental X-rays. We like to take the X-rays annually typically, and if you are reporting a problem, we like to take them as well. I just don't have X-ray vision myself. I wish I did, but I do not. So it helps me see things in between your teeth, in the jawbone that I normally cannot see or feel. And so we use them to help us diagnose cavities that are maybe starting or already big enough to do in between your teeth. It helps us know where the bone level is in between your teeth to kind of gauge some gum disease if it's present or not, and then make any recommendations that we need to based on what we see on the radiographs. As I mentioned earlier, sometimes I don't get to see what I want to see on the X-rays, and I'm relying heavily on the patient reporting the symptoms to me. And so we've been finding over the years that sometimes my two-dimensional X-rays I take in my office are just not good enough anymore. So we're now going up a level where we're doing 3D or CT X-rays to kind of get a better understanding and visual of what the problem is. Typically, the person's reporting a root canal symptoms, but I just can't see it on X-ray. But I know that they need a root canal, but also I don't know which tooth. That's where the CT scan can come in handy because we can slice and dice the X-ray any way we want to, and we'll reveal which tooth typically is the problem, and then we can zero in on that and make sure we treat the right tooth. That is so important. So yes, X-rays are harmful to us. It damages our DNA, and luckily our DNA can repair, but in those instances where it cannot, it typically leads to cancer. So we hope that we're using the lowest dose possible, and because we've moved into digital X-rays these days, we are giving you the lowest dose possible, and we're trying to minimize as much as we possibly can so we don't do it all the time. And I have some of my patients where they have no problems year after year, so I don't mind not taking X-rays every year. It's just not necessary because their history that I've been seeing them for a number of years is telling me that they don't have that many problems. But when we do take the X-rays, we just want to have all the information in front of us so we can present to you as much information as possible about the condition of your mouth, your teeth, and your gums. And that's what we're trying to do. We're trying to diagnose everything, if there's anything, and let you know so we can make an informed decision about treatment in the future. If you have any questions regarding this topic of X-rays, please let me know in the comments. If you have another topic that you wish me to present, also leave me a comment. Thank you very much for being here. I really appreciate it, and welcome to my Dentistry Tuesdays. Take care, everyone.